this video is going to be my birth story for my daughter that was born earlier this year. I've been meaning to sit down and film this for so long, and I kept all of my followers on TikTok in such suspense for ages, and I really didn't mean to at the time, but there was a lot that went on with this birth, and at the time I got halfway to updating everyone on TikTok, and then the videos just cut and I couldn't tell anymore. So this is like my official birth story of letting you all know what exactly happened during that time. So I'm going to start from the beginning. I'm going to include loads of footage. There's going to be like timestamps, videos, photos. I'm going to put loads in because when I was pregnant, all I wanted to watch was birth vlogs, birth stories from the UK. That's all I wanted to watch because I wanted to go in with as much knowledge as possible of like the different outcomes that there could be in birth. So this is going to be an in-depth, lots of detail, you know, story. So I'm going to start from the beginning. I'm sorry if I'm reading off my phone a lot, but all of my notes are in here. I literally can't remember what I had for dinner last night, let alone what happened during labour. So luckily I noted all of it down in my notes. I've literally got a notes page that says early labour and then goes on to labour, so that's how I'm going to remember everything. So just for context, I had a completely normal pregnancy. All of my scans were fine. Her positioning towards the end of pregnancy was completely fine. My due date was Friday the 7th of March 2025. So I got to Friday the 21st of Feb, and I started noticing I was having some cramps daily, but I would literally say like 2-3 cramps, if that. There was just a cramp, like a contraction happening in my body from the 21st of Feb. So that was like 2 weeks before my due date. I think that would have been like, I think that was bang on 38 weeks actually. Yeah, that was bang on 38 weeks. So I started noting down these contractions because, well, not contractions, but these cramps, because I knew that it would either escalate into actual contractions or some people just have like cramps for the weeks before birth. But I just wanted to note it so I knew what my symptoms were leading up to labour. So I had one at 9 AM and then I had another cramp at 11, and that was it, nothing. And then the next day I had 4. One at 3 PM, 4 PM, 8 PM, 11 PM. So they were getting a little bit more regular, but they weren't like contractions, definitely not. They were literally just a period cramp and like spaced apart within hours. So that was the Saturday. And then the Sunday, this is where things started. 3:30 in the morning on the Sunday, I woke up to sharp lower back pain on my right side. I called triage, they weren't concerned at all because I had no other symptoms. It was literally just random sharp pain on my right side at the back. And then I woke up with the exact same sharp lower back pain at 8 AM again a few hours later. And then at 2 PM I had dull like period cramps again. And then at 5:30, me and my boyfriend were laying in my bedroom and literally just normal. I got up to go to the toilet, went to the bathroom, went for a wee, stood up by the sink washing my hands, and I just felt my pants just go really warm. And I was like, what the fuck is that? I was like, surely not. So I pulled down my trousers to have a look, because obviously that feeling normally is like the first day of your period, like when you feel the blood. Not to be TMI, but this whole video is going to be TMI, so I don't really care. But you know when you feel that and you're like, oh right, let's go get a pad or something. It was that feeling, and I was like, obviously it's not the start of my period, so what is that? Pulled down my trousers, and I kid you not, it was like somebody emptied a water bottle onto the floor. It just went gush, and all this water just came out, and I was like, my waters are just broken, oh my god. But I never imagined it to be that way. I always imagined it to be like you have contractions and then at some point your waters break and then, you know, labour progresses, but no. So my waters went and nothing happened after that, like immediately nothing. It was just my waters. So I just shouted, I was like, Alex, Mum! I was like, my waters are broken! They were like, what? I was like, come here right now. So they both came into the bathroom, and on the floor you could just see this clear fluid. And they were like, you sure? And I was like, I swear to God, it's not wee. Like, I got a bit on a tissue, smelt it, wasn't wee, wasn't, definitely wasn't discharged, because it was literally like a water bottle amount had been tipped onto the floor. So then we were like, right, well, what do I do now? Because I've got no contractions. Like, what do I do? Mum was like, well, you need to call triage at the hospital. And I was like, oh my God, yeah, I need to let the midwives know that. I just dropped the camera. I was like, oh my God, yeah, I need to like let the midwives know. I didn't even think about that. So I called the midwives at triage, and they were like, yeah, can you come in please? And I was like, what? Wait, what? Like, why is this happening now? I think I was 38 plus 2 at this point. So I was like, what's happening? Because all that's happened is my waters have gone. So like my brain couldn't process, like there was no build up to this point of going into hospital. Like it was just waters going to hospital, and I was like, this is not how I pictured it to be, but like, okay, let's roll with it. So I picked up the hospital bags, put them in the car, went to the hospital, and they tested my water. No. So I went straight into like a ward, got given a bed, and they did like a swab and a urine sample, and the swab was to test if it was my waters that had gone or if something else was like leaking or something. So they sent the test off, came back like half an hour later, and they were like, we can confirm it was your waters that have gone. And I was like, oh my God, okay, so what happens now then? They were like, well, usually like your contractions would start within the first few hours of your waters breaking, so you can either labour here and wait for your contractions, or you can go home and wait for your contractions. And obviously as a first time mum, I didn't know whether this was going to come on really quickly or not. So my first thought was, let's wait it out for an hour. If contractions don't start within an hour, in my head it's safe to go home and it will probably build slowly. So we waited for about an hour. We got McDonald's brought to us from a family, because obviously we were expecting to be there all night, and nothing happened. And I was like, oh, okay. So this was now like 9 PM, right, on the Sunday. So I was like, right, let's go home. And the midwife said, we're going to book you in to come back in tomorrow, like 24 hours later, because we don't like you to go more than 24 hours without being induced after your waters are broken, because there's a risk of infection now that there's no barrier between your baby and the outside world. I was like, oh shit, this really throws a spanner in the works now, because just to let you know my preferences, they were no epidural, don't be induced, basically don't have any interventions unless they're really, really needed, and avoid a C-section. So like, yeah, any type of being induced, didn't want it unless it was really necessary. But obviously now that they've thrown in this whole like risk of infection, I was like, now I feel like I can't really argue with saying no to anything that they're suggesting, because if something happened, I wouldn't forgive myself for saying no to them intervening. So I was like, right, okay, this is like got off to a bad start here. So I was like, right, do you know what? Labour's going to start for me naturally. I'm going to go home. Overnight, nothing happened. Woke up at home the next day. Nothing happened all day. I stayed active. I was bouncing on my ball. I was trying to get things going, and they just weren't going. So then we went back in, I don't know, like 5 PM on the Monday. And this, just to set the scene, right? The night before we went in, this ward was empty. There was one other lady there, and that was it, right? There was staff floating around. It was dead quiet. We went in 24 hours later to this same ward. It was heaving. There were no beds. There was no spaces. The staff looked all frantic. There were no doctors around. And I was just like, I literally feel like I walked into a war zone. Like, what is happening here? And the midwives were like, right, we've got a bed here for you, but like, we're going to leave you for a little bit because the doctors are so busy. We've had like emergency blood loss cesareans come in, so they're really preoccupied right now. We've got like a backlog of patients here waiting to be seen by the doctor, so you just will have to wait your turn, but the doctors know you're here. They know you're here to be induced. They will get round to you shortly. So I was like, do you know what? It sounds good to me, because to be honest, I was going to go in there and say, look, I want to wait longer than 24 hours before being induced. That was just my preference. I was like, I want to give my body even more of a chance to like get things going before we step in. So for them to say to me, we're going to have to wait, I was like, fine by me. Met myself at home. So we just sat in the room. I asked the hospital for an exercise ball. I was just bouncing around in there. To be honest, we had a great time. Alex was with me the whole time. And yeah, so that was at about 5 p.m. And then, right, let me see what happened next. Right, by this point, I was losing pieces of my mucus plug too. So that was also developing. So like my body was showing all the signs that like labour was about to start any minute now. So I didn't have anyone check me until 10:20 p.m. that night. That's when a midwife came and checked on baby's heartbeat. All good, loads of kicks, fine. I then didn't get someone come back to me until midnight. And I had the monitor put on me for movements for 30 minutes to make sure that she was still okay with like considering that the waters have gone but nothing's happened. And then, so half an hour later they came back after monitoring my movements, and the midwife looked at the screen and she was like, can you feel that? And I was like, feel what? And she was like, you're having contractions. I was like, what? I literally can't feel anything. I was like, what do you mean? She was like, look at the screen, you could see like the contractions. I was like, well, that's weird. She was like, well, at this stage you are 1 centimetre dilated, and you're having some tightenings but not full-on contractions yet, and your cervix is still really long, and I think when you're like ready to give birth it's really short. At that point on the monitor I was contracting once every 10 minutes, so it was regular but not like enough for anything to happen. And after that, so she did an internal check as well, and after that my bloody show went. So like again, it was just all these signs that something was happening but not fully yet. So the midwife was like, look, it's been over 24 hours now. Nothing's really started. Your body's ready, but it's not started. We would really, really like to put the pessary tablet in you. And I was like, whoa, what do you mean? Like, I really, really don't want to do this. And she was like, look, the pessary tablet is like the lowest form of being induced. Like, all it does is kickstart things if your body's ready. If your body's not, it won't kickstart much. And I was like, look, how long does this last? Because I was very cautious of the hormone drip. I've heard a lot of I've heard a lot of horror stories about that. So I would rather try like a lower level of being induced first. And she was like, oh, this only lasts like 6 hours, and if it doesn't work we can put the tablet in again. But what I didn't know at the time is that a lot of women have to have the tablet twice before it works, and the tablet gets put up inside you, and it like releases the hormone that I think makes your body contract. I don't really know, but I know it releases a hormone. But yeah, I didn't know at the time that you could have it twice, but I think the reason they didn't offer it twice is because I had a risk of infection, so you know we had to get things going quite quickly. So I had the pessary tablet put in. I agreed to that because I was like, do you know what, this is minimal intervention, it's just going to release a hormone, it's not like forcing anything, if you know what I mean. So by 3 a.m, so like an hour and a half, 2 hours later, I was contracting every 2 minutes, and they weren't painful at all. They were literally like, my stomach would go rock solid and it just felt like a period cramp. That's all it was at that point, but it was every 2 minutes. But it was bad timing, and I do regret not getting up and standing up or walking around whilst this was happening, because this was now through the night. This was 3 a.m, so I was trying to sleep at the same time, and so was everybody else in the ward. My camera died again, sorry. So I really should have got up during the night, should have moved about, but I attempted to get some sleeping whilst I can, because that's what everyone advises you. You know, if you get a break in contractions, sleep, because, you know, everything's going to start happening soon, so sleep whilst you can. So I woke up at 7 a.m, and I was still having contractions, but they'd really slowed down. Like, I was feeling them during my sleep, but they were like minimal. So it was very clear that the pessary tablet had started to wear off, and so had my contractions. So it had basically faked contractions for the past 6 hours, and it hadn't actually triggered anything. So now my body was just back to square one and nothing was really happening. So by sort of 8, half 8, the contractions were getting stronger, but they weren't getting any faster, so again, wasn't progressing. So in my mind, I was going to say to them, look, please can you do the pessary tablet again? That was going to be my next thought process when they next come round to see me. So they actually didn't come round to see me again until 10 a.m. And this was the doctor, finally, right? This was finally the doctor that I've been waiting to speak to since 5 p.m. the night before, and it was now 10 a.m. Anyway, I'm not going to complain because they obviously had emergencies to deal with, but yeah, I had been left by the doctor this long, just want to make that clear. So the doctor came in and they said to me, we're going to take your bloods, just make sure there's no actual infection brewing yet, and then we're going to move you across to labour ward and we're going to start the drip. And I was like, whoa, no you're not going to do the drip. That's not what I want to happen at all, and I don't think it needs to happen at this stage. But they were kind of like peer pressuring it. They were like, well, you know, risk of infection, it's now been like 36 hours since your waters have broken, you know, we don't want her getting infection. And I was like, yeah, I completely get what you're saying, but like, don't come in and just like tell me what the next instruction is. Like, it's birth at the end of the day. It's not just like a surgery that like happens the same every time. Like, birth is very individual. Like, don't come and tell me the next step when there are plenty of other options. So I was just a bit like in shock, so I didn't really say anything at that point. I was just like basically, please leave the room so that I can think about this. So they left the room thinking that I was about to be moved across to labour ward to start the drip. Then a lovely student midwife came around to like do my regular checks, and I like released all my thoughts to her. I was like, please, I don't want to start the drip. Like, I want them to make sure that I've not, because bear in mind, nobody had done an internal check on me since the night before. So what if after all of this pessary tablet I had actually dilated to like 4 or 5 centimetres? Like, who knows? Like, women deal with pain differently. There was nothing stopping my body from being 5 centimetres at that point and them not realising because they hadn't checked. So I was like, look, I really want them to check me before they start the drip. And the student midwife was like, they will check you, don't worry, like they won't do the drip if you're past a certain point, so they will always make sure before they start that. I was like, okay, well, I really don't. I was saying to Alex, I was like, look, I really don't want to do this drip. Like, that is not what I want to do. And then the next midwife came around to do like the next check after that, and she was like, and she completely backtracked, and she was like, you won't be given the drip at all if you're contracting. I was like, I am contracting. She was like, you don't look like you're contracting, you'd be in a lot of pain if you were contracting. I was like, mate, I literally am. Like, go and look at my record of like my like me being monitored last night, you will see that I had contractions. And she was like, well, you don't look like you're contracting. I was like, excuse you? Again, women deal with pain differently. Like, don't tell me what I'm feeling, what I'm not feeling. I'm telling you I can feel it. So then I was like being told 2 different things. Like, yeah, they'll give it to you and they'll make sure that you're not too far along first, or they won't give it to you at all if you're already contracting. So I was like, what is going to happen when I go across to this labour ward? Like, I don't know what I'm expecting to happen here. Oh, this second midwife that wasn't as nice also said to me, women are given the pessary tablet to pop their waters. So I said, why did you give me mine then if my waters have already gone? And she backtracked again and she said, oh, to make you contract. I was like, right, okay, so I'm being told so many different things here. I don't know what's happening. I don't know what the plan is. I don't know how far along I am. All I know is I'm having contractions that are just wearing off now. I really don't know what's happening. Bearing in mind at 10 a.m. this morning was when the doctor come and said to me, you're going to be moved across. And at that point she said to me, by midday latest you'll be over there. We're just waiting for a space to come available and you'll be moved across. So I was like, fine. I'll just chill out, have some lunch with Alex, you know, just carry on until they call me. They then, after a lot of moaning from me. They then did not move me across to the labour ward until 4:30 p.m. So what's that? 6.5 hours later, I got moved across to the delivery suite. Again, the only reason why I'm pissed off about this is because on one hand they keep saying to me risk of infection, but then in the same breath they're delaying me so much. They're basically neglecting me by leaving me so many hours without checks, without coming to see if I'm okay. I could be like ready to push, but they don't know because they've not checked on me in 6 hours. So it's now the evening on Tuesday and my waters are gone on the Sunday. So it's now been, what, 2 full days since my waters have gone and nothing's really happening again. So we get to the delivery suite and they were like, look, we're not gonna rush any decisions of being induced. This midwife was absolutely lovely. She was like, let's just do a check and we'll just see where we're at. I was like, okay, fine, breathe. So we did a check and I was, by check I mean internal check, so I was only 2 centimetres dilated, right? So the pessary tablet hadn't really done much. So she did an internal check and she was like, good news, you have progressed slightly to 2 centimetres from 1. Bad news, your waters hadn't fully gone. I was like, what? You're joking, you're lying. My words to her were, you're lying. She went, no, your waters haven't fully gone. I was like, oh. And before I could even say anything, she was like, this is probably the reason why labour hasn't been progressing for you. Hallie's head, basically there was like an air bubble, so there was a tiny bit of the backwater still stuck behind her head. So that air bubble was preventing Hallie's head from pushing down on my cervix and actually like dilating it further. So all of this hard work, all of this pessary tablet was doing fuck all because there was no way that she could dilate my cervix even more. So it was just stuck at this stage. So I was then annoyed because I was like, why is nobody else that have done my internal checks seen this? And if they had checked me more often, someone would have picked this up, that my waters hadn't fully gone. So I was fuming again because I was like, really, it's now got to the stage where I've not got many options left because it's now 48 hours of risk of infection because of the waters, whatever. So I was like, oh, right, okay, well, she was like, right, go and walk around for 2 hours. I'm going to give you 2 hours before we do any intervention. Give your body a chance, walk around as much as you can to let gravity help you. And hopefully things start moving now that I've just popped your waters. By the way, she popped my waters and it was so painful, like I literally cried in pain, and I never cry in pain, and it was instant tears because it basically felt like, it was really sharp pain, and then it literally felt like this barrier had just been broken between the pain and me. So like I just suddenly felt all these contractions that I hadn't really been feeling the past 24 hours. So like these contractions hit hard and I was like, wow, it like took my breath away. I was like, panic, cry, oh my God, I can feel this now. So then I walked around for 2 hours and I felt that she had dropped a lot. Like I could feel, it literally felt like her head was like coming out. And I was just like, I can feel so much pressure. I was like waddling around the hospital. We went downstairs to get a hot water bottle for my mum, who dropped it off at the hospital reception. And I was like waddling down there. I couldn't bear to walk back. Alex had to wheel me back upstairs to the delivery suite from one of the hospital wheelchairs because I just couldn't even walk. I was just like, this feels so heavy down there. But I was still in a good mood because I was like, I'm happy that things can now finally progress. I felt like we was finally on the up. So then, 2 hours had gone by. I was now contracting once every 3 minutes, I think. I think it was like once every 3 minutes, but they weren't lasting very long. So I went back and I was like, I'm contracting and they're regular and it feels like it's happening. And she was like, yeah, you're still not contracting enough, so let's start the drip. I was like, okay, well, I've tried. You know, I've given my body 48 hours. It's not really done its job, really. through no fault of my own, nobody noticed the waters hadn't fully gone. So we're on a time crunch now, so let's just, do you know what, put my pride aside, let's just do the hormone drip. But Alex was amazing. He was like, he knew my preferences, so he said to them, he was like, look, if she's gonna do it, she wants it started on the lowest setting possible, you know, can we stop it at any point? He was great asking all these questions, because my mind obviously just wasn't in it. My mind at that point was like, panic, we're having the drip, oh my god. So he was asking all the logical questions. He was like, can we stop it at any point, start on the lowest setting, how do you stop it if it gets too much? And they were like telling me all them details. So we were like, fine, do you know what, let's just get the ball rolling. So I started on hormone drip. This is where my TikTok stopped, because I was in no fit state from this point to keep recording. This was just the biggest blur, but also I will never forget the next few hours after this. 8 p.m. we started the drip, and it started off okay. The contractions they continued, they were getting closer, they were getting stronger, and I didn't realise she was upping it. Obviously that's how it works anyway, but that was not in my thought process. So I was just dealing with the contractions as they were coming. I was breathing through it. Breathing was really, really helping me, like more than anything else. Breathing through these contractions, like blowing them away, really, really helped. And I just want to describe contractions for anyone that's not been through it. In my experience, it just felt like not as bad as I thought it was going to be. That's me being honest. It was like a really, really strong ache that was like really, really, really strong. But it wasn't like a contracting pain like I thought it was going to be. It was just like a really strong, I don't know how to describe it, like I would say like a period pain. Like a period pain is like a really strong ache, pain. It's really hard to describe, but yeah, it wasn't like a contracting. Like I couldn't feel contracting, if that makes sense. But yeah, it was okay. But they were getting stronger and closer together. As they were ramping up, I was changing positions, and gradually the position changes weren't helping, and the breathing was starting to help less. And I was like, oh, okay, this is getting really hard now. Now it just feels a bit like survival, like just get through this pain and there's nothing I can do about it. So I was just, you know, just dealing with the pain. So then it got to like 11 p.m. and I was just out of it, like in terms of like I was just pain focused. There was no chance I was picking up my phone for anybody. There could have been 5 people in the room and I wouldn't have noticed. I was just so in this pain zone that I was just like breathing through it, having a break, breathing through it, having a break, and it was just getting repetitive, and I was just like, this is just taking over my mind. So the thing that was bothering me the most was I couldn't find anything that was working, obviously, because it's literally like contractions from labour. So I went to the toilet, and the only thing that was helping was sitting on the toilet. So I've literally got a photo, I'll probably insert it, I don't really care, of me sitting on the toilet with my midwife, and it was just sitting on there, just regular contractions. So that it was now hard to get back, because I had a toilet in my room. It was now hard to get back from the toilet to the bed without having a contraction. That's how regular they were, like it was just non-stop. So it then, I don't know, again, I don't know what time it got to, but let's just say it then got to like midnight, and I was like, look, this is becoming unbearable. So I then started the gas and air. Gas and air did nothing for me, absolutely nothing. Yes, it was helping my breath control, but I was doing that anyway without the gas and air attached. At one point the gas and air pipe came off the back of it, and Alex noticed and I didn't notice. So that just shows how much it didn't really do anything for me. It was just the breathing that was helping, which I was doing anyway. So then at some point between like midnight and 2 a.m, I was just like, it was just ramping up, and I just found it really hard to breathe in between these contractions, because there was, the hard part wasn't the pain, it was the fact that there was no break in between these pains that was like making me panic, because I was like, how can I breathe through these when there's no break? I'm just constantly in pain. So I was like, right, we're either gonna have to turn the hormone drip off, or like something needs to happen, because I can't just sit here and just bear this, like I can't catch a breath. So I was like, to my midwife, I was like, we need to do something. So she offered like paracetamol, codeine, didn't touch the sides, gas and air wasn't helping. So she was like, right, you can either have an epidural, have a C-section, or we can stop the drip. But if we stop the drip, it will stop the progress. And I was so desperate for a vaginal birth that I did not want, I just wanted it to progress. So I was like, fine, keep the hormone drip on. I want an epidural. Big statement, but I want an epidural, because I want to be able to see this through, to see her be born naturally. So she was like, fine. She went to speak to the anaesthetist. I don't know. She went to speak to the guy that does the epidural, and she was like, he's going to be 20 minutes. He's in a surgery at the minute. He knows you're waiting. He's going to come straight to you and do it after. I was like, fine, okay, we can do this. 20 minutes is like, I don't know, let's just say 6 contractions. It's fine, we can do this. So then about that time passed and he wasn't here. So I sent my midwife. I was like, Isla, go and get that man. I'm desperate, go and get that man. And this poor midwife, she was like, okay. So she went back out and she was like, really sorry, but he's just not ready yet. Like he's busy seeing someone else, like he'll be here soon. And I was like, how soon is soon? I was like begging, I was like, please, someone get this man. I need this epidural, I can't breathe. And obviously I don't know, but from my mind it was like an hour had passed after that and he still wasn't there. And I was like, no, go and get this man, because I can't breathe. Like there's only so long I can go without feeling I can't breathe. So the midwife went one more time and then she came back with him, and I was like, thank you so much. Like this man walked in, he was bubbly, he was lively, he was this northern man, he turned on the lights, he literally physically brightened up the room with his personality, everything. And I was just like, oh my god, I'm so glad you're here. It just felt like instant relief. And then he talked to me through the whole process of the epidural before he did anything. So he was like, it's go time. Sit on the bed, turn sideways. This is obviously after he explained everything to me. I had to put my knees on Alex. I just want to explain this epidural process because it was not what I expected, right? I thought it was a needle in the back and it was an injection. It was not. That's not all an epidural is. Maybe I was naive thinking that that was it, but that's what I thought it was, because everyone talks about the epidural needle and that's it. So I just assumed it was an injection of some numbing stuff. So turned to the side and he sprayed something, right? Something freezing cold on my back, and it like shocked me and I was like, oh my god, what is that? I don't know if it was like something antiseptic or antiseptic, don't know, or if it was just like an ice cold spray to numb it, or like a numbing spray. I don't know what it was, but whatever it was freezing cold and it shocked me and I was like, oh my god, I thought that was it and it wasn't. And he was like, that's just a spray. And I was like, fuck, if that's just a spray, then how am I going to deal with the epidural needle that's about to come? Then he was like, right, there is a needle going in now. He was like, stay really still because this is really dangerous if you move when this goes in, because it can like hit the wrong place. But I was conscious of that anyway, I already knew that. So I stayed really still, it's fine. And he was like, you might feel something. He was like, it might throw you forward, so just try and stay really still. So it went in, it didn't throw me forward, it just felt like pressure on my lower back, but it zapped my back in like 5 places. I remember it so clearly. It was literally like somebody had electrocuted 5 places on my lower back. And I was like, oh my god, what was that? I can only assume that that was the nerves or something. I don't really know. He was like, right, now it's time for the actual epidural. And I was like, what? What do you mean? He was like, well, now it's time to actually put the epidural, like, medication in. I was like, is that not what you just did? He was like, no, I just put the tube in. I was like, tube? What do you mean tube? And he was like, there's like a little tiny rubber tube hanging out the bottom of your spine. I was like, oh my god, oh my god, oh my god, I'm so glad I knew that after you've done it, because I had no idea that's what it was. And he was like, now we'll connect you. I was like, connect me to what? And he was like, to the epidural medication. and there was a, what's it called? Like a little trolley next to me with the medication in like a drip bag, and it was like attached to me. And he was like, this is how you can top it up, there's a button next to it. And I was like, what? This is blowing my mind. This is not how I thought it would go. Anyway, I couldn't really feel the epidural medication go in, apart from it was really, really cold when it went in. But apart from that, it was fine. The worst bit was done. I was like, what? This is just so mad. And then he put like ECG tabs all down my back to like, I don't know what for. I don't know. Really don't know. But yeah, so then I just laid back on the bed. And he was like, this will kick in about 20 minutes. The medication's feeding through as we speak. Like, just relax. And I was like, wow, okay. Oh my God. That was it. It's happened. It wasn't that bad. So just after that, my midwife was like, let's go to the toilet quickly. Otherwise you'll have to have a catheter put in, right? So just let's go for a wee. Now, get your blood emptied. So I was like, great, let's go. Because I do not want a catheter put in me. So she literally, like, I was like half numb. We like quickly walked into the toilet, had a wee, went back to the bed, literally just chilled out. And, you know, just chilled out for however long. And I was just like, great. And she was like, have a sleep. And I was like, yeah. Because by now it was like 4 AM. And I was like, okay, let's have a sleep before everything starts, you know. Because labour's about to happen. Like, I'm about to give birth. Let's, again, have a sleep. Alex had a sleep. I had a sleep for about an hour. Okay. And then I woke up to the doctor coming in, and she was like, please can we do a check and see what's happening. And by the way, I forgot to say, when I got the epidural done, I made them turn the hormone drip off because I was like, look, this is all too much. I need to catch a breath. Let's just pause everything, get the epidural, and then reevaluate. The doctor come in and she was like, let me do a check. You are 4 centimetres dilated. I was like, right, amazing. Amazing. I'm 4 centimetres, I'm progressing, you know. It's now, I think it's now classed as active labour, I don't really know. And she was like, no, that's not good. You should be like at least 6 centimetres by now and you're not. I was like, oh, okay. And she was like, it's also now been like 60 hours. It's now been like 2.5 days since your waters have gone. Like, this is not looking good. Basically I want you to consider a C-section. And I was like, what? No, we won't be doing that. So she went away and I was like, look, we're not doing that, that's not happening. Alex woke up to the sound of C-section. He was like, what's going on? And I was like, nothing, they just suggested it, like, it's fine, we'll just go a bit longer. Then they came in, I think maybe half an hour later, and she was like, have you made your decision? And I was like, can I just give me a minute? I didn't know I need to make, like, I didn't know I need to make a decision. So I asked the doctor to leave the room so I could call my mum to discuss my options. Called my mum was like, look, just get it over and done with. It's been long enough now. The risk of infection is getting more and more. Like, you've given it your best shot. Like, just meet her now. Just go and meet your baby. Like, just take the C-section. And I was like, okay, fine. And literally as that phone call ended, the doctor came back into the room and she was like, I'm so sorry to interrupt. I've been watching your baby's heartbeat on the monitor and it is dropping and dipping and we're not happy about it. So I don't know what your decision is, but we're going to make the decision for you. You're going for a C-section now. I was like, shit. Okay, fine, let's go. So that was it. After all that, I was wheeled round to the operating theatre and I had a C-section. But I will talk through the C-section process. So, went in, they chopped up all the numbing stuff, and the anaesthetist was behind me. He was amazing. I'm so glad he was there. And I said to him, I said, please, the only thing I want from this whole experience is I want the birth filmed. That's all I want. And everything else so far has been out of my control. This is the last thing that I want. And he was like, fine, absolutely fine. Took my phone. He literally made a movie out of this C-section. Like, he filmed so much, he got so many photos, videos, everything. He went above and beyond. He was amazing. I could not have asked for someone better to be sitting there beside me and Alex. So within minutes, right, he was like, can you feel that? And I was like, what? And he was like, they've started. I was like, I can't feel a thing, right? I'm numb from tits down, can't feel anything. They put on music for me. They were like, what do you want? I was like, I don't know, put on the radio. And they were like, you can't give birth to the radio. And I was like, fine. The first thing that came to my head was Beyonce. So they put on Beyonce. So they were all just dancing around the room to Beyonce. It was so surreal. I was like, what is happening? At this point, I'd forgotten I was having a baby, right? So then a few minutes in, they'd started. And then a few minutes later, he was like, right, you're gonna feel like really like a lot of pressure on your stomach when they're taking the baby out. So I was like, okay. So I felt nothing until that point, and then I just felt like someone dropped a fridge on my stomach, right? I was like, oh my god, she's coming out. And then she just got lifted over the curtain, and I was just like, oh my god. We both just started crying. I was just like in shock because she looked massive. All the doctors were like, oh my god, that's at least an 8-9 pounder, like how has she come out of you? So I am going to include a little montage now of, you know, like the labour, the birth. I just want to include all the footage of the C-section too, and I won't go into detail yet of the recovery because I want the C-section recovery to be a whole separate video. Because for anyone that's not had a C-section, they won't really care. That's just me being honest, I don't think you'll care. But C-section recovery, I'm going to do a whole separate video, so if you want to watch that you can, or if you've been through it and want to hear how I recovered with it, you can. That will be out soon. But yeah, so I hope you enjoy this little montage. It was really a difficult time, but it was also the best time. Me and Alex had such a good time in hospital given the circumstances. He didn't leave my side at all, and he was the most amazing birth partner I could have asked for. And I would do it all again in a heartbeat to have her, and that's not even me just saying that. I would do it all again. I'd probably do it differently, but I would do it all again. But yeah, that was my birth story. That was the reason why it escalated so much that I then couldn't breathe, let alone update TikTok. So that was how little Hallie was born. She was born at 7:18 AM on Wednesday the 26th of Feb 2025, weighing 7 pounds 1 ounces. So she was born at 38 weeks and 5 days. But yeah, enjoy! I was standing at the sink here, doing my nose. I just felt it all come out.
I don't think it's a good idea. I think you should stay here.
Oh, William. Oh, William. So I went up to the hospital to get checked and like swabbed and stuff, and like to confirm that my waters had actually gone. And they did some tests and stuff, and I was all fine, and my waters had gone. And she said they're happy for me to either labour at home or I could stay at the hospital. So I waited a few hours, and I thought if nothing happens, if no contractions start, I might as well just go home and just be at home. Like, I don't feel like I should be at the hospital taken off a bed for no reason when I'm not in any pain. So I decided to come home. It's now, I think it's about 7 AM. Yeah, so I chose to come home. So we got to the hospital, I think maybe like just after 6 PM last night, and then we left just before 9 PM. So I'm home now. So the plan of action is they've booked me in to go back into the ward at 5:30 this evening to do a full examination, see if I'm dilated, assess the situation, and then they'll let me know my options. It is absolutely manic here. I don't think the doctor's going to be able to see me anytime soon. They're just so busy. And yeah, I'm still waiting for my first like actual proper check. And it's been 3 hours. So yeah, no contractions still yet, nothing. But I did ask, and Alex is allowed to stay overnight, so that's really, really good to know. No matter what happens, he's allowed to stay, so I won't be alone. We've still not been checked. I just want to know if I'm dilated at all. Bouncing on the ball and trying to keep myself set upright, but nothing's really progressing. I just don't know how long to leave it. If they offer me to get the induction tablet, I don't know whether to just accept it now or give my body a few more hours to start contracting and stuff. I don't know.
In terms of where, we do like 34, 35 weeks, absolutely comfortable here. We have plenty of babies who are born around that gestation.
It says where the breathing. Where's the forks?
I'm like a geezer with my t-shirt.
Yeah, it says where the breathing ends. Where's the forks?
So much pressure. It was actually coming out my arsehole.
Here we are with Mr. Disability. Let's go for a walk, she says. Can't even walk.
Whoa, stick to the speed limit. Nothing yet. Just on the ball. I had contractions all through the night. Don't know how regular, but they didn't feel very regular. They just slowed right down. But I think it's because I had the pessary tablet and then went to sleep, so. I just got given my lunch and I'm still waiting for a space on the labour ward. I'm contracting and about 12 hours ago I was 1 centimetre dilated. No idea what I am now, but I'm getting strong contractions and yeah, literally just waiting for a space now. It's go time. In my sexy stockings. I can't believe that like this is gonna be where we meet her. Like, how crazy is this? And yeah, it's a good idea my maternity pillow's not on the bed because it would just get covered in so many fluids. But to be fair, these pillows are quite thick in this ward, which is good. But I need to work out what position is most comfortable when I have a contraction. I'm gonna wait and see what my next one's like on this brawl. Guys, I'm absolutely going through it. Alex just popped out to get some more drinks, but I've got a contraction starting right there. So we're officially on the delivery suite. This is our room. So we got here and she was like, I'm going to do all your checks before we give you anything. I was like, great. And then monitored baby for half an hour. Baby was fine. I was having no contractions though. It had really slowed down. And then she was like, right, I'll do your internal checks now. She checked me. I was 2 centimetres dilated. And you'll never guess what? There was still waters in there that was blocking baby from making any progress. So she was like, oh, well, change your plan. Gonna have to break the rest of your waters. And when I tell you that was the most painful thing of this whole experience so far, I cried straight away, like instant tears. And then it was just instant cramps. As soon as she put my waters, it was like instant cramps and I just burst into tears. It was so horrible. And then since then, I don't know what time she broke my waters. I think it was maybe just over an hour ago. I don't know. Yeah, once she did that, I've had regular contractions ever since, every like 4 minutes. But they're letting me go 2 hours before they check me again. And if my contractions are regular enough, then they'll leave me and won't do the drip. So hopefully, she was like, go and get walking and keep these contractions regular. Otherwise, we'll have to use the drip to keep it regular now that they've started. So I'm just waiting for Alex to get back from getting some drinks and then we're gonna go for a little walk. Oh my God, but I got a cannula in, ready for the drip that I might not need.